name is Brad Kellogg. I'm with Houston Methodist Hospital, and I want to spend a little bit of time, and it's my pleasure to be with you today, to talk a little bit about creating and maintaining successful global healthcare partnerships. And many of you in this room, some of you are from all over the world, and some of you are from this region. And so it's an opportunity as we get together from around the globe at Global Health Exhibition to talk about how we can partner together in a sustainable way. A little bit about Houston Methodist. We are a 106-year-old hospital system in Houston, Texas. We have 9 hospitals, and that is our focus, is caring for patients and serving the communities in Houston, Texas. But in that 100-plus year legacy that we have had many partnerships around the globe. And so we've learned a lot about what makes a successful partnership and what may make a challenging partnership. But as we talk about partnerships, we want to first level the field. So not all partnerships are the same. If you can see on the left of the screen, we start off with partnerships with that may be based around philanthropy. So this may be from an international location or a regional location to a developing country to look at how we can improve the healthcare in that country through philanthropy. And that has a very light depth of relationship. That moves on to collaborations, and collaborations have a little bit deeper, but still they're still loose and not so binding. It moves a little bit deeper as we go into networks. These have been a trend over the last 10, 15 years to have networks of partnerships where partners can enhance their quality by benchmarking with another organization. They can get education and knowledge transfer. And then we move even deeper in the relationship to affiliations. And this is typically where you're looking at a deeper, longer relationship. And then you can move in even further to a managed partnership where the organization may bring leadership and may operate that facility, or even deeper still, a joint venture where there's investment from both partners. But one of the key points, and sometimes we see that this is done out of order, but as we start a partnership, the partners need to understand the why. There's an amazing book that came out a few years ago called Start with Why, or Start with the Why. And so for the regional partner, for some of you in the room, as you may be thinking about embarking on a partnership, it's really to say, why do we want this partnership? It might be to improve quality, it might be to improve service, maybe have access to best practices. It could be about education and training. It could be implementing new services or new innovations and technologies. Also, it could be that partnership may assist in research and helping with recruitment of new staff, as well as branding. It could be that, okay, we want to partner with this international partner in order to have and elevate the brand. And for those of you that are in this room that are from an international organization, you as well need to understand the why. You need to understand, why are we embarking on this partnership? Is it because we want to increase our global footprint? Is it because we want to expand access to global learners for training and education? Is it about sharing best practices with others? Is it about increasing the quality of services in the markets that you serve? It could also be about building healthcare capacity or expanding your marketing or increasing international patient access. So all of these are valid answers to the questions why you want to embark on this partnership. But really, time needs to be spent, because a strong, sustainable partnership is going to be one where there's strong alignment between the regional partner and the international partner. So don't jump too quick past the why. Make sure that we understand why we want to engage and why we want to embark on these partnerships. So once we have the why finished and solved, we move on to the what. So the what is what we're going to do together. So we know the why. Now what are we going to do? And I want to say that there's no one size fits all for a partnership, nor should there be, because the partners are different. Each organization is different, each country, each healthcare dynamic is different. So we need to customize the scope and we need to customize the relationship of what we're going to do together. And during this scope definition time, we want to make sure that it's important that we each spend time in each other's locations. So, you know, many of us would not buy an automobile if we'd never seen it before, if we've never taken it for a test drive, if we've never even, sat in the seats. But sometimes partners join together who have never even seen each other's locations. So we want to make sure that during this time of building the what are we going to do, that we spend time in each other's locations, because what we found is sometimes we can, we have proposals and we do things on paper, but when somebody comes and sees something live, they say, oh wait, if I had known that was there, I would have included it in our scope. So spend time in each other's organizations to understand the environment, to understand what might be possible. The third point here is a caution. And I just want to say, beware of being overly optimistic about aspirational goals for what you can achieve in the time frame of this partnership. Sometimes, if you want to start a new advanced clinical service, that may take capital investment, it may take construction, it may take recruitment of staff. And if your time frame is 1 year for the relationship, it's unlikely that you're going to see that through. So just a caution, word of caution there, don't be too overly optimistic of what can be achieved. So moving on, we have the why and we have the what. One of the critical components is trust. Healthcare is a business of trust. There's an excellent book called the crisis of the healthcare crisis of trust. But what a strong, sustainable partnership is going to be one that is built on trust and is not built on transaction. So what do I mean by a transactional relationship? So on the left side of the screen, you can see a relationship that is built on transaction. You see trust goes down, speed goes down, and cost goes up. On the right hand, you see a relationship that's built on trust. We see that trust goes up, the speed goes up, and the costs go down. And just a practical example, if you're going to go and you're going to go have lunch, and you go to Al Baik or any other restaurant, and you order off of the menu, it's expected that you will pay them to receive that food. That's a transaction. That's a transactional relationship between you and the restaurant. But if a close friend invites you to dinner, and you go to his house and he's been barbecuing all day and he's made a wonderful meal, and after the meal is done you say, okay, well, I had a salad and I had a soup and I had a burger, I guess I owe you about 70 riyals. That he would be offended. That means that you've taken that relationship that's built on trust and you've made it transactional. So a strong, healthy, sustainable partnership will be one that is built on trust. Trust can be built over time with clear governance and strong transparency between both parties. So one of the things that we've learned is the idea of, just like a child, you first crawl, then you walk, then you run. As trust is built between the parties, you're able to accelerate. As trust goes up, the speed goes up, and we're able to move much faster. So a healthy partnership needs to be built on trust. One other component is, okay, a partnership of entities from different parts of the world is going to encounter regulatory differences as well as cultural differences, both cultural differences in the countries that the partners are coming from, as well as cultural differences in the organizations. And so there is no copy-paste solution. So just because a solution worked in your entity doesn't mean that it will work in the environment of your partner. So in order to navigate that, we need to start with curiosity. We need to seek to understand. We need to not say, oh, that's wrong, you need to do it, but we need to have an idea of saying, okay, well, that's different. It's not necessarily wrong. There might be some things that are wrong, and for patient safety and other things, we may say, no, that's wrong, we have to change it. But there might be some ways that we execute healthcare that are just different. They're not wrong. And so having flexibility in problem solving is very important. There might be different dynamics in your regulations that mean that role that exists in your home healthcare entity doesn't exist. There isn't even a license for that role in your partner's entity. So being able to be flexible, looking at, okay, how can we evolve and adapt this solution or this best practice in order to make it applicable and to make it sustainable. One of the key components of most international partnerships is knowledge transfer. So knowledge transfer, one of the key points is to understand and define what is the DNA that we want to transfer between entities. And the word DNA there is important because it's something that we want to be replicable. We want it to continue. And so we don't want this to just be, again, a transactional, we send somebody for training, they came back, but when that person leaves our organization, that training went with them. We want to be able to transfer DNA, and that could be maybe the DNA around patient experience, that could be the DNA around your values, your organizational values. It could be just even the DNA around how we work together as multidisciplinary care teams. But we need to spend time defining that, and then we need to look at, okay, not just what is the knowledge, but what is the culture and the change management that needs to happen in our culture in order for us to receive and replicate that knowledge that we got. And so this goes into capacity building so that you build the capacity locally so it's not creating dependency on your other partner. It involves collaboration, which includes coaching, mentorship. And one of the things that I want to just point out is that healthy knowledge transfer is bidirectional. It's not just one entity giving information or giving knowledge to the other. It's learning from each other. And so having a sustainable partnership is one where there will be that bidirectional knowledge transfer. An amazing success story that we've enjoyed is that 50 years ago, almost 50 years ago now, one of our physicians, Dr. Michael DeBakey, performed the first open heart surgery at King Faisal Specialist Hospital here in Riyadh. And that was amazing, and we had a legacy of knowledge transfer where we sent physicians over to perform surgeries and educate and train physicians here in Saudi. But as that relationship has evolved and as healthcare has matured and as our partnership has matured, we're actually sending some of our transplant physicians to King Faisal to learn how they're doing some of the new robotic techniques and how they're caring for patients, as well as they're sending physicians and other learners to our organization in order to better understand some of our best practices. So a healthy, sustainable international partnership will be one where the knowledge transfer is bidirectional. So once we've defined the why, we've defined the what, we've started this partnership, now we need to measure it and we need to benchmark it. Because we all know if something's not measured, it isn't managed. So we start and we define realistic KPIs. I say realistic there because sometimes our KPIs are not achievable. They're, again, back to that aspirationals. We want to be at this level, or we want to increase our volumes by 40% in 2 months, and it's not realistic for the partnership, and the partnership can't sustain that. So we need to define realistic measures for our partnership. They should be both qualitative measures as well as quantitative. We need to look at outcomes. We need to look at processes. We should have metrics for the relationship that will help us in monitoring that and benchmarking it. As well, there needs to be tools and forums for ongoing evaluation. This could be a monthly steering committee or a quarterly visit or an annual symposium where we review and the leadership goes through and looks at the measurements and benchmarks and evaluates how we can improve as the relationship progresses. Also want to look at the importance of shared success criteria. So what does success look like for both of the partners? And that's the goal, is we want for this partnership to be sustainable, we want it to be a success for both of us. So just a few red flags from our experience, from the literature, from some of the things that we've seen. These are the things that might be partnership red flags. So when you have misaligned expectations and goals, this is going to decrease trust. It's going to make it much more difficult for this partnership to be a success. It's going to mean that there's going to be energy and effort spent on things that don't add value to the partnership because our expectation and our goals are not aligned, so we're not working and pulling together. Another red flag is when we have a short-term vision and a transactional approach to this relationship. And I understand that many of us, okay, it needs to have clear objectives, it needs to have clear scope, it needs to have deliverables and metrics so that we can monitor how are we progressing. But when it comes down only to those things, okay, how many times, how many minutes did we have phone calls? How many documents did we send and receive? That transactional approach can be a short-term vision of the partnership, and it can add strain to it. When there's a lack of clear governance and decision-making, this is also a red flag. If there is a breakdown between the leadership, it can cause tension, which will end up not having that partnership be a success. One additional note here, and especially in this region, we have a high turnover of leadership. And that shouldn't be taken lightly. It doesn't mean that the partnership will fail if there's a turnover in leadership. It means that we need to focus back and make sure that we're still aligned. Make sure with the new leadership that we've realigned the why, that we've understood the what, that we've realigned with the new leadership the expectations and goals, and that we've spent time to rebuild that trust. And so that change in leadership doesn't mean that it's going to be a failure for the partnership. It just means that we need to spend a little bit more time and energy to rebuild that trust. Poor communication and cultural insensitivity, that's a clear red flag of why a partnership may fail. And then an absence of a long-term planning or exit strategy. So having a vision of, okay, when does it look like that we will maybe be able to end the relationship, we may be able to move on, we may be able to adapt that relationship and move along the line from maybe network to affiliation to managed or go the other direction. And so having a long-term vision of what that partnership success and endpoint looks like is important to the sustainability of the partnership. So in conclusion, the world is smaller than ever. The evidence of that is clear. For the fact that we're all here in Saudi together for this amazing conference proves that the world has gotten smaller. It's also true that there's much to be learned and gained through international partnerships. There's opportunities for us to take the best things from the kingdom and implement them in other parts of the world, and take the best things from the other parts of the world and implement them in the kingdom. And successful partnerships are partnerships that are built on trust and that have a clear alignment and clear vision. And one of the things that I'm excited about with international partnerships is that international partnerships are one of the ways that we can all work together as we look to solve the healthcare challenges of the future. Thank you.